been here for about 5 months, but during that time I've learnt a huge amount about the work that is done here and a little bit about the work that is done by the wider National Health Service.
Hello, I'm Anne James, Chief Executive of the Trust. I think we all have our common goal to really support our patients, then we can achieve a great outcome for them.
Well, because I didn't know any different, I suppose it was all right, but it was a bit dingy. It was dingy. I mean, this is fantastic now, isn't it? So bright. It really is lovely here.
When assessing a patient with viral hemorrhagic fever.
Mask, waterproof gown, double gloves.
Yeah, I always knew really that was the first people. And I kind of used it as like a badge of honour really in school and stuff, like letting everyone know that I had some kind of cool thing about me.
Awarded
£30 million to build a brand new department for urgent and emergency care.
The bereavement bags that was born out of a personal experience of collecting my mum's belongings.
Now, next on the programme, patients with a rare form of cancer are living longer thanks to a specialist clinic at Derriford Hospital.
Around 500 patients a year are diagnosed with mantle cell lymphoma in the UK, and many travel to Plymouth to access the groundbreaking treatment.
A clinical trial was offered to Margaret by Derriford Hospital. She says it saved her life.
Thank you, Chairman.
Fantastic organisation with brilliant people. What would you like to say on the birthday?
Well, this being the 70th anniversary and birthday of the NHS, we just want to say a really big thank you. I want to applaud all the people who've worked in the NHS for the last 70 years. Today we'll be celebrating all of our staff, volunteers, colleagues in social services and across the NHS today. And let's really look forward to our new colleagues that will take forward the NHS for what I hope will be another fantastic 70 years.
I'm very pleased
To declare
that
Keep Me Close open.
So we just wanted to give a little bit of an update on where we are in terms of our response to COVID and perhaps give a little bit of an explanation of some of the measures that we have in place.
Who looked after Ian and cared for him so diligently. You are all heroes and deserve the total respect of the nation. So that was you. You did that. You made that special moment. You did a really good job.
Right.
I'm just so pleased to be where I am now and to get home to see everybody.
Thank you, all of you.
We are going to be receiving samples from all over the country, and samples will arrive here and they'll be tested through our lab for positive and negative COVID tests.
363,549 vaccinations have been delivered at Home Park alone.
I'm James, I'm one of the physios up on healthcare for the elderly at the moment, and I'm really looking forward to the ICP. It's going to improve our relationships and our effectiveness of working with our community colleagues.
I think any reflection on the last few years has to incorporate the response to COVID, and that has to be the public and professional response within the NHS.
Handing out masks on the front door. Used to start at 6:30 in the morning and we'd finish at 9. It was meant to last for 6 weeks, and a group of us did it through for 9 months. And we really felt a part of the hospital team, keeping everybody safe.
Worked under an honorary contract in ICU during the pandemic, and certainly saw how many skills were needed to get through the difficult times. Lots of teamwork. And then partway through I joined the tissue viability team, where that teamwork continued. Some of the team were redeployed, which was a struggle, but we did all pull together to work in the right direction, and I think everyone supported each other in such an amazing way.
The way our colleagues dealt with such a huge change to our service, when our service absolutely couldn't change. Babies still need to be born.
Is being part of a team that throughout COVID has pulled together to provide a flawless service.
Working here is like being part of a big family, and every day is completely different.
Across acute paediatrics, it's an absolutely brilliant workforce and a great service for our local communities and actually some regional families as well. And I hope for them that they have the investment that they deserve to continue to take that service forward.
I'm really excited to see our relationships develop with our training facilities, our universities.
There's also the extension going on for the building, and I think that's going to offer us new opportunities to work with other teams and make a difference.
I'd love to think that 10 years from now that the bookshop was still thriving and that the hospital continues to thrive as well.